Melissa McCarthy. I'm going to be performing the central line dressing change, so I'm just going to scan the room. And so before I walked into the room, I would verify the hospital policy. Then when I walk into the room, I would perform hand hygiene while introducing myself to the patient. Now I'm going to take the order sheet and compare it to the patient wristband. So we have Jaguar Jones, birthday 8/25/1963, birthday 8/25/1963. Allergies are penicillin. Do you have any other allergies? Okay. And we do have an order for routine central line care per unit protocol, so I can put this to the side. And now, I'm going to put this to the side. And now I gathered all my equipment, and I do have my trash can positioned. And then now I'm going to assess the site through the dressing. So I'm just looking at the site, I can palpate it. And then I'm going to, since my trash can is positioned once again, so I'm going to perform hand hygiene. And then I would raise the bed to a working height while lowering the side rails, and I would position the patient with his head slightly elevated. And I would like to note that my working height is slightly below waist level, and I would want it above waist level in the hospital setting because every time I am reaching over the sterile field, I am contaminating. And so now I'm going to take the kit out of the wrapper, throw this way. I'm just going to do the first one. And it does reveal a mask, so I'm going to put a mask on me and goggles on me. And then I'm going to place a mask on the patient. I would assist him if he needed help putting the mask on. And so now I'm going to put on clean gloves. And I'm going to remove the Tegaderm. And when I remove this, I want to pull it towards the insertion site, and I want to stabilize the catheter while I am removing it. So now that I do have this removed, I am going to place it inside my glove, and I'm going to observe the insertion site of the catheter, and I'm looking for any signs and symptoms of complications, and signs and symptoms of that would be redness or drainage or any like swelling or edema, and I want to assess it without touching it because I did take the dressing off. And at this point, I would obtain a culture if I needed one. So now I'm going to remove my clean gloves with the dressing inside of it. And then I am going to perform hand hygiene, and I'm going to open the rest of my kit. So we want to do the sides and then towards me. So now that I have that set, I'm going to put on my sterile gloves. Okay, so, and once again, my working height is below waist level, so in a hospital setting, I would want it above. So now that I have my sterile gloves on, I'm able to grab things in the sterile field. So first I'm going to grab my alcohol swab, and then I'm going to clean in circular motions around, and I want to keep my gloved hand well away from the gown. And when I clean in circular motions, I don't want to go over the same site multiple times. And so I can throw this away. And now I'm going to clean using the ChloroPrep. So for this, you would pinch this to activate it. And so you would pinch it until you heard a click. And then I'm going to lift this up, and you want to clean in horizontal and vertical directions for at least 30 seconds. And you also want to clean the hub. And you clean for at least 30 seconds. So now I'm going to throw this away. And so now that I did clean, I would allow it to dry. So once it is dried, I'm going to do the BioPatch. And this hand is now contaminated, so I won't touch the sterile field with this hand. And so with the BioPatch, you want to slide it on, but you don't want to touch the skin or the catheter because your hand is sterile. So you just want to make sure it gets on nicely. So once I have that on, I'm going to take my dressing. And so with my dressing, since this hand is contaminated, I can just touch the wrapper with it. So I'm going to open this. I can throw this away. And then I just want to touch the outside with my contaminated hand. And so when I put this on, you want to make sure you stabilize the hub as well. And you want to make sure that the dressing is flat. And then I'm going to remove the white marks. And when I do this, I want to push down on the edges, making sure that they are tightly sealed. And so now that is all tightly on, I would remove this, and I would put the date, the time, and my initials, and then I'll take it off and put it on the dressing edge with the date, time, and my initials. And so now at this point, after I applied the dressing, I'm going to remove my gloves and my mask. Then I'm going to remove the patient's mask. And then I would raise the bed to a working height, or I would lower the bed, raise the side rails, and I would position the patient comfortably with the call light in reach. And then I would dispose of all my equipment and perform hand hygiene. And then for my documentation points, I would document the appearance of the site, the amount characteristics, and the color of the drainage if there was any. I would document if there was a culture taken, and I would document the type of cleanser used. So for this, we use the alcohol swab and the ChloroPrep. I would document the type of dressing, so we use Tagderm. And then I would document how the patient tolerated the procedure, and in the documentation, I would put the date, the time, and my initials.